Good evening, everyone, and welcome to One Healthy Boston's Facebook Live. I'm Kristen Perfettio. If you have COVID-19 questions, then this is the place to be tonight. I'm joined with Dr. Simone Wildes, an infectious disease expert at South Shore Health. Dr. Wildes is going to talk to us tonight about the latest developments in testing, access to testing, and other ongoing safety initiatives that are happening in our healthcare system and throughout the country. Dr. Wildes, I want to thank you so much for joining us tonight. I also want to encourage our viewers at home to send in any questions. This is your opportunity to talk to Dr. Wildes. She'll do her best to answer those questions. To get started, Dr. Wildes, and again, thank you for joining us. I want to get to an interesting fact that occurred today, or at least was rolled out today. The New York Times reported that 4 million Americans have been infected by COVID-19. Where does Massachusetts stack up as far as those numbers? How are we doing exactly?
Kristen, thanks for having me. The great news is Massachusetts is actually doing quite well compared to the rest of the country. As you can see in other parts of the country, for instance, Texas, Florida, California, the numbers are really skyrocketing. However, here in Massachusetts, the numbers have been trending down. That is really encouraging for us, means that we're doing the things that we've always been talking about to make a difference. Wear the mask and do social distancing.
Yeah, I was just going to ask you that question. What are we doing right exactly as far as the state goes?
I think first and foremost, the leaders have taken a stand in making sure that masks are mandatory. So everywhere you go, people are wearing their mask. And that's really important because masks make a difference. So when you wear your mask, you protect me and vice versa. People are really adhering to that. I've also seen a lot of people following the social distancing, and that helps. So those two together, in conjunction with doing hand hygiene, make a huge difference.
Governor Baker has also been really strategic, I think, as far as rolling out different phases as well. Do you think that's come into play? I mean, we haven't just opened up bars and nightclubs and all of that. We've been sort of strategic about how we reopen business as usual, if you will.
Yes, he has done a really great job in making sure that a phased approach with regards to reopening. You will see that, he'll open for a certain number of weeks, and during that time, he watches the numbers to see whether or not we're ready for the next phase. I think that has really helped us, and as you can see, the numbers are down. So clearly, we're all doing something right.
What are you seeing as a clinician at the hospital? Are you starting to see less and less patients now, and are symptoms less severe? I mean, just walk us through what you're seeing.
I can definitely tell you we are not seeing as many cases as we did 4 months ago. However, we do have other patients coming in with their other medical conditions, and so we are really busy. But I want to use this opportunity to encourage everyone, if you have any other underlying medical issues, please come to the hospital. We need to take care of you too. I don't want you to think that the hospital is not open to you. Please come, you needed some help.
Yes, I had spoken with Dr. Jason Tracy, our chief of emergency medicine here at the hospital. He had mentioned a very similar experience where they weren't seeing as many heart attacks or strokes or people with issues with diabetes coming into the ED. It's still very important to come in and be treated for those conditions, correct? Hospitals are safe, right?
Yes, absolutely. We have all the things in place that we're going to try to keep all of our patients safe. So I don't want you to try to manage it at home. Come to the hospital. We can take care of you.
Okay. It's summer. People are outside on vacation, or at least trying to fulfill their vacation or their dreams or their plans, if you will. Patricia at home wants to know, in your opinion, is it safe to go to hotels? And also on that same topic, is it just safe to travel in general?
That has been a really common question that I get asked all the time. I would say if you really don't have to travel, then I would say put it off for a later date. However, you can go traveling with your family, but if you're thinking about doing some exotic trip, I think this might not be the time to do that. With regards to hotels, if you absolutely have to go, then by all means go. But I think at this time, we just want to be a little bit more cautious about our travel because as you go to different places, you might contract the disease and you might run into some problems when you get there.
Gotcha. Are there certain safety measures that people should take when they go stay in a hotel, if you will? Does it, for instance, if you can even get your hands on Clorox wipes, does it make sense to sort of wipe things down? I mean, I don't know. Any advice to people who are going to places like that?
I would say always travel with Clorox wipes, Perel. You always try to clean surfaces down now more than ever because, they might not do a very good job. And we know that the virus can live on surfaces. So I would say definitely travel with your Clorox wipe, definitely Perel more frequently than you normally would. Wash your hands whenever possible. And of course, wear your mask, do social distancing when you are out. One thing I want to add is that for the summer, we like when you're outdoors because we find that being outdoors, the virus is not as at risk for being transmitted to as many people as possible. You definitely can enjoy more outdoor activities versus being inside in an enclosed area.
Getting back to travel again, and I know we keep talking about this, but a lot of now states are requiring that if you come into their state, you have to prove that you're COVID-19 free. You may need a test. How can people even access getting tested if the test is only being reserved for people who have symptoms? Can you talk us through that a little bit?
Well, one of the things you have to do is first just have a discussion with your provider. Let your provider know what you want to do and see if they can guide you where you can have tests. Because we do have places like, the drive-through where you can get tests or a particular clinic that you can have a test done. So I don't want you to be like, I cannot get a test. There are places that we can get the test and you don't have to do a very long wait in order to do that. And it's also important to find out what the requirements for each state are so that you don't show up and somebody asks you, where's your test? And you're like, oh, I didn't even realize I needed to check that.
Gotcha. So you do not have to necessarily have symptoms or have symptoms of COVID-19 to get a test, correct?
You don't. I mean, if you are going on vacation for a certain state and that state requires you to have a test, you're going to need to have a test.
Okay. All right. Bonnie wants to know, and this is regarding testing as well, the immunity test or antibody test could come back positive while swab tests can come back negative. I think she wants some clarification on that.
I have to tell you, this has been a very, very difficult topic because there's been a lot of mixed messages with regards to the results and how we interpret it. The gold standard that we're using right now is called the nasopharyngeal test, which is a PCR test, which you don't have to worry about that. But the gold standard is that's the test that we use to assess most of our patients, where you put the swab in your nose. That is what we commonly do. However, on the flip side, there is an antibody test, which is a blood test. And the aim of that test is to see whether or not you have been infected with the coronavirus in the past. The problem with this test is it is not as accurate as we would like it to be. And so it's very difficult for us to be able to assess whether those results are actually true or not. So if you tested positive with the antibody test, the big question is always, oh, does that mean I can do what I want to do because I have tested positive? And the answer to that is no, because we don't know how long your immunity will last and how effective the test was. So two very different tests. I think right now, until the FDA has worked out some more details with the antibody test, we're not really using the antibody test to assess immunity. We're using more the nasopharyngeal test, or another test was the antigen test.
Interesting. Okay. As far as the immunity goes, what are you learning about it at this point? Are you learning that once you have it, you're set for life, or does that immunity go away and you could get COVID-19 again?
Everyone wants to know, if I've had it, does that mean I'm set for life? I do not have an answer to that. I think that's something that we've all been talking about, that, we wish we knew, but I think right now we do not have the answer. So that means you cannot take for granted that you can stop doing the things that you're normally doing because, your immunity might wane and that means you might get infected. To date, though, there has not been any cases from individuals who have had a reinfection with the COVID-19. So to date, nothing has been done, has been identified as a reinfection.
Okay. Amy wants to know your opinions on the reopening of schools. This is a really hot button issue. I, as a parent, am also having a little apprehension and anxiety about what's the plan going to be this fall. What are some things that schools should really be keeping in mind as they start to get ready to unveil their plans this fall?
I'm also a parent, so I have lots of angst about what to do. So I can totally relate. I think the key thing is you want to keep the parents and the staff, as well as the students, everybody needs to be happy and needs to be informed. So, the safety of everyone needs to be addressed. And so, first of all, you have to see what plans does the school have for keeping everyone safe. There's a lot of meetings that's going on, and I think you need to be a part of it. Are there going to be enough room in the classroom for the children to safely socially distance? Are there going to be opportunities for the children to take their mask off? They call it mask breaks, opportunities to clean their hands. What happens if students are sick? What happens if the teachers are sick? So there's a lot of unanswered questions, and I think there needs to be open discussion and people need to feel comfortable. And I know that there have been many different options in terms of what we're going to do. Is it going to be remote learning? Is it going to be a mixture? What is your school or your school district going to do? You have to have those conversations and be very comfortable with it.
Mm-hmm. But there should be some things that parents should be prepared for, right? I mean, it would seem obvious that masks are going to be a required safety protocol that children are going to have to wear when they go to school. What can we talk to our kids about as far as preparing them for a day of wearing a mask or keeping their mask handy?
I think that one of the things we can actually do is by having our kids wear masks at home to get them into the habit of wearing a mask for the entire day. Because, those of us that are out and about, we wear a mask every day and you actually get accustomed to it. For children, it might be a little different. So you want to get them into that habit so that when they go to school, they are not constantly taking off their mask. Another thing you want to do is to really help them not to keep touching their eyes, their nose, their mouth, because the virus can get in that way. That's just, something that's teachable that we can all do. Want to encourage them to continue to wash their hands with Perel or soap and water, just basic things that we need to prepare them for. And also, I think that some children might be a little bit apprehensive about going back to school where you cannot really hug your friends, you cannot do as much of the sports that you're accustomed to. We need to have the discussion with our children so that when they go back, they're not completely caught off guard as to what the new school year is going to be like.
Sure, sure. I think like with anything that's new and where we don't have enough information in it and it's scary, there always seems to be some skepticism about how serious something is. This virus, we've had some folks question the seriousness of it. How do you respond to concerns about those who are not necessarily truly believing that this is a serious pandemic and that testing is very important?
I always say, look at the number of cases that we have. And at the beginning of the show, you talked about over 4 million cases. That is a lot of people, and that number continues to grow, and it keeps growing every day. It's not like things are slowing down. In fact, things have gotten significantly worse compared to where we started. And I think as the numbers grow, you're going to find that you're starting to know people that actually have the disease, and this starts to hit closer to home. So it's not just an arbitrary thing, but it's something that's really happening. And if you have anyone in the medical field, you can talk to them and they can share their stories of what it's like to really see people suffer from the disease, to see people die. This is not a hoax. It is real, and people are dying every
question from Jimmy, and this will give me some education as well. He's asking about the R number. I'm not sure what that is, whether it will lead to rising cases. Can you explain the R number and answer his questions?
So the number he's talking about is, what happens when the infection rate is really high. So the key is you want to have that number as low as possible to show you that you're getting the infection under control. And so the higher the number is, the less likely it is that we're going to be able to reopen and get everything back to normal. The goal is to get the number as close to 1, 2 as possible, because that means that we're controlling the virus very well.
Okay, well, thank you. That was an education for me as well. Gladys and Kelly are asking if anyone has gotten the virus twice.
To answer that question, there is no one that has had the virus twice to date. I know there has been a lot of speculation about whether or not you've gotten the virus twice, but the CDC yesterday came out with information that said there has been no instance to date of someone being reinfected. And that was done after looking at a number of different studies.
Okay. Two folks have written in this evening about false positives, and they want to know how often that happens in testing, and how is it caught, and how is it handled?
False positive is something that, thank goodness, we don't see a lot, but like with any test, there's always going to be some risk of getting a false positive test. I think you have to look at the entire picture, not just the test. And so for us, whenever we see a patient, we always put their story with the test, or pre-test probability, as we say in medicine, with what are the odds that this person is going to have the disease? And if my suspicion is very high, then I'm going to think I'm having certain expectations with regards to what my results would. And so if I don't think, and I'm never 100% right, but if I don't think that this person has the test and it comes back positive, I'm going to be a little bit concerned about that. So, you really have to put the whole picture together. And sometimes you end up retesting because it just doesn't make sense, or it's not very clear with what your anticipations were.
We're joined this evening by Dr. Simone Wildes, an infectious disease expert at South Shore Health. She's answering all of our questions tonight about COVID-19, so send us your questions. We have Marie at home asking for advice if she needs a test within 72 hours, but some providers are taking 10 days or more to return that test result. What can she do? What's some advice?
That's a tough one because, we can always order the test, but it really depends on where your provider sends the test. And I would say you probably have to talk to your provider to see if they can outsource the test to some place that they can get the results faster. It really depends on what is available in your community and what access your provider has.
Okay. Kelly wants to know any advice for handling anxiety related to the virus and going out into the world. I mean, the world has changed in the last 4 months for sure.
Yes, I agree. I think, we've seen a lot of people who have had mental health issues, and those who didn't think they have mental health issues now really wondering, how am I going to cope? Because it really is something that has changed our lives. This is not normal for us. And one of the things that I would say first is, if you have a good support group at home, or if you have friends that you can talk with, you can always start there. If you realize that's not really meeting your needs, you can always talk to your provider. Other things that can work, yoga, exercise, these are just other outlets. Talk with friends at work, at church, just other people, see how they are coping, how can they share. Also online, you cannot go and meet people, but you can have a Zoom party online. You have to get creative as to how you can try to handle this anxiety. But if that all fails, remember your provider is there. They can get you into someone that can help you work through it, because we're all coping with it, because we don't know how to deal with all this new change, not only for ourselves, but for our children, for our workplaces. It's very difficult. It's a great question.
For those who are willing to take the step outdoors and get together with friends, Dr. Ellerin, who has been on this segment several times now, calls it quarantining, if you will. Your core group of people that you hang out with. You can do that safely, correct? There's a way of doing it.
Yes, it's a way of doing it. Earlier on, I said, outdoor activities. So, for instance, if you want to go out for dinner, we encourage outdoor meals. That's something we're comfortable with. We really don't want to promote a lot of indoors with a lot of people because being inside in close quarters increase the risk for transmission of disease. And, a plug there is for bars. One of the cases, a number of cases we've seen where people go to bars, there are people shouting, there's people drinking, they're sharing food. So we don't want you to be indoors at a bar right now, even though you might feel like you want to have a drink. But to get back to the question, it is okay to go out with a core group of friends that they're healthy, you can share the space safely. But again, outdoor activities are encouraged. So exercising, hiking, this is the time to do it as the weather is really good here because that's not going to last forever here.
Sure, that's true. Flu season's right around the corner, unfortunately. Krista at home says she is severely immunocompromised. Now, she has to probably take a different tact on this, right? What would be your advice for her?
Yes, so the patients that or individuals that are immunocompromised, what we have found is these individuals, when they get COVID-19, they really have worse outcomes. So you have to be very aggressive about making sure that, everyone around you is wearing masks, you stay away from those that are sick, and you make sure that you clean. You just have to be a little bit more cautious than the average person because your immune system is a little different. And of course, I want to encourage you, if you feel sick, make sure you get in touch with your physician sooner rather than waiting until things are in dire straits. Because when you get sick, you could get really sick. So just be really in tune with what's going on with your body.
Okay. Remelina is asking about a vaccine, potential vaccine. She has heard that there may be some steps that are being skipped in the process of developing the vaccine. She's just asking, is that accurate? Have you heard anything like that? Are steps indeed being skipped or just condensed to get this vaccine out?
So the word that's being talked about is that the vaccines are going at warp speed. But I want to reassure you that even though it's going at warp speed, they are making sure they follow all the safety steps to make sure that when this vaccine does become available, that it has met all the protocol guidelines with regards to safety. So I have not heard that because, especially with the Infectious Disease Society, we've had a lot of meetings about this, that we're trying to make sure that the safety and the efficacy of the vaccine is followed, even though things are going so fast, because we do not want to have any repercussions after the vaccine is out saying we didn't follow the steps. So absolutely not. I can reassure you that they're doing everything, even though things are going fast.
Okay. Mark at home is wondering, what is the recovery rate for COVID-19?
So it really depends on what your initial illness was. If you had mild illness, what we have found is that you recover a lot faster. So I do not want to put a specific timeline because each person, their body responds different. However, what we have found for the cases where it's mild to moderate, you recover faster. Now, if you are severely ill, you had to be on a respirator, that is going to take a much longer time to recuperate than someone whose illness was mild and didn't need to come to the hospital. So it really depends on the level of sickness that you had.
Okay. There are certain steps that people take when they're diagnosed with the flu, when they're at home recovering and hopefully isolating themselves from their loved ones with the flu as well. Taking the fever reducers, drinking lots of fluids and all of that. Are there indeed steps that patients who are COVID-19 positive teaming at home or isolating at home that they can do to help sort of ease their recovery or help their recovery process?
It should be a straightforward question, but I think it's hard because I think we always encourage patients, just like when you have the flu, monitor to see how you're doing, check your temperature. Are you getting dehydrated? Is the disease, the illness progressing rapidly at home? I think if you're not improving in a short period of time, I think you need to seek medical attention because what we have found is people try to do their own remedies at home, and then when they come in, they're severely ill, and so it's a lot harder for us to try to help you to recover because you are so far advanced in your illness because you thought you could manage it at home. And so, for instance, if you're home and you're really short of breath, don't think it's going to go away. You need to come in and get reevaluated.
This is a very different virus from other viruses that you've worked with in the past, correct?
It's so different. I mean, keeps me on my toes every day. I can tell you the information I told you today. Maybe next week somebody else might have some very different bits of information because we're learning as we go, and that makes it interesting, but at the same time, very challenging.
Lindsay wants to know if rapid nasal testing results are as reliable as the deep nasal swab testing.
So I have to tell you the deep nasal test, that's the gold standard that we use. So the rapid test, it is not as good, but I think it works quite well, but it's not the gold standard. And it really helps us with testing. There's been a lot of talk about testing, not having enough tests. And so this is just one way that we can help to try to help us bottleneck with tests. But definitely it's not as good, but it works.
Okay. David is asking your opinion on eating out at restaurants. Would you eat out at a restaurant? He wants to know.
I would eat out at a restaurant if I'm eating outdoors. I'm not about to go indoors where it's crowded, where it's enclosed, where the circulation of the air is not as great. But I definitely want to go outdoors and eat. It's really like a breath of fresh air to be able to go out and have a meal as if everything was back to normal. So I think that helps me with just giving me a sense of calm that, at least I can have a meal with my friends and family outdoors, but definitely outdoors, not indoors. And of course, making sure that social distancing is being practiced at the restaurant.
Okay. And Linda she wants to know whether patients that you've seen have had any long-term or long-lasting symptoms after recovering from COVID-19?
That question, I don't know if I have a good enough answer because we're still in the midst of it, and so it's very hard to see. You probably have to give me a little more time to see how they're doing because I think, some patients are still recovering from having it a few months ago, and what is going to happen in another 2-3 months, they might be back to normal. There might be some residual effects, so it's really just a wait and see.
We're just about out of time, Dr. Wildes, but before we wrap up, I just wanted to ask you if there's something that you would want to really reiterate to our viewers at home. What would that advice or what would it be that you would want them to know? What have we learned?
I think I want to really encourage everyone to remember COVID-19 is still with us. It has not left us. We are still trying to make sure that we find definitive therapy, work on a vaccine. And while we do that, we want you all to continue to wear your mask, to continue to practice social distancing, wash your hands, clean high-touch areas. Just really be vigilant because we have done a great job so far and we could be the example for others. So let us try to continue to set this example so that, we can all be healthy and well and get together when we all get beyond this COVID-19 infection.
Awesome. Thank you so much for joining us tonight. All such great advice. We really appreciate you taking the time out of your busy schedule. I want to encourage the folks at home who didn't have a chance to watch this whole segment. You can log on to onehealthyboston.com. It will be there. It'll also be on WCBB's Facebook page. I do want to say thank you to WCVB TV for allowing us this opportunity to bring this content to you on air tonight. Thank you so much for joining us. Everyone have a great week, and we will catch you here again next month.
Thank you.